Ballad Health Hospital saw another spike in COVID-19 hospitalizations over the weekend. The healthcare system that serves this region reports 355 COVID-19 patients in their hospitals today. That's 33 more than the last report we got from Ballad on Friday, an increase of more than 10%. 73 patients are in intensive care unit, with 48 of those patients now on ventilators as of today. And of note, the number of pediatric COVID-19 patients at Niswonger Children's Hospital more than doubled over the weekend, going from 4 on Friday to 10 today. Joining us now is Ballad Health Chief Infection Prevention Officer Jamie. Let's first start with these numbers. What are you seeing?
Unfortunately, we're seeing the impact of COVID. When you have this many cases in the region, we are going to see an increase in hospitalizations. Our data team, our projections have us going this high and higher. So unfortunately, I don't think these will be the highest numbers that we see. I've
got the scorecard that you send out every day. Ballad Health sends out every day. Just a couple of notes. Back to that 10 pediatric COVID-19 patients. That's on the higher end of what we're seeing. Any thoughts on what's happening in your pediatric unit?
I think you're starting to see exactly what we thought would happen. So unfortunately, as kids are back in school and group activities with Omicron, it is so contagious. You get 10 positives for every positive. We've not dealt with an infectious disease like that. So having that number of positives in the community, we've certainly seen an increase in overall positives in our children. Some of those kids are going to be sick enough to end up in the hospital.
And are you finding that most of, I know in the past you've said, in fact, most, if not all, your kids coming in sick have not been vaccinated. Is that holding up true? And also, is that holding up true that your sickest of patients in the adult sections of your hospitals have not been vaccinated?
I can speak generally. Obviously, I've not looked at every single case today, but generally we are still seeing that trend of overwhelmingly the people that end up in the hospital are not vaccinated. We know the vaccine is really doing a good job of keeping people out of the hospital, out of the ICU.
One more thought on this scorecard. I'm noticing you're saying your positivity rate's at about 29.7. After 2 years, we've learned that means about 1 in 3 tests are coming back positive. What does that say to you? I know you've said in the past, give me a positivity rate in the 5% range. Here we are at a 30% range. What's that say to you?
It really tells us that there is widespread community transmission. And what we know is that is definitely an underreporting. We know that a lot of people are doing home tests. A lot of people may think they're sick and not test, but the overwhelming majority of people that do that home rapid test, that never gets counted in anybody's number. And so we know that what we're seeing is truly just a tip of the iceberg right now.
You deal with infection control. I want to ask you a question about that medication that we'd heard that was going out into the community through the Walmart and Sam's pharmacies. It was in very short supply. This would be medication for people who've tested positive and who were at higher risk. Are you hearing that that's getting into the community?
I do know some patients that have received it. Unfortunately, those supplies are limited, certainly across the state and obviously within this region. So, if you qualify, certainly talk to your physician. There's a lot of drug-to-drug interactions, so you want to make sure that your physician is reviewing all of your medication. And then, honestly, it's just a try and see if you can get it. So get that prescription, see if you can find a Walmart that has any in stock.
Also in short supply has been that monoclonal antibody that we've now learned needs to be specifically for Omicron, right? And that it had been in very short supply, not only in our area, but nationwide. What's the latest you're hearing on the ability to get people that monoclonal antibody treatment for the Omicron variant?
Nothing's really changed. That is still in very short supply. States only receive a certain shipment from the federal government. So unfortunately, we're just not seeing a ton of that coming to the region.
Jamie, early on we had heard that the Omicron variant was most definitely more transmissible, highly contagious, but maybe would be less severe. Are you continuing to believe that that might be the case, that the Omicron variant of COVID-19 might be less severe?
We are still seeing what, it's hard to use that term. So we're seeing a very large spread of illness, as we've talked about. So it is highly infectious. And I know people want to kind of jump on that. It's mild, but you have to remember with that many infections, you're going to see hospitalizations. You're going to see people, especially in the unvaccinated population, that are still progressing to severe disease. So I don't want people to walk away thinking, oh, it's mild, it's just a cold, we don't need to worry. This is still a disease that is causing severe illness, putting people in our hospital, putting people in the ICU, and still causing death.
It seems like a lot of people are sick, if not just with COVID, with other things. I mean, that's my man on the street perspective. I'm curious of yours too. Are you seeing that?
We are, right now, overwhelmingly, the majority of illnesses are COVID, but there are still things circulating. Flu is still circulating. It's gone down, but it's still out there. We've seen, para-influenza, just various diseases that still circulate during the winter months. They're still there as well as COVID.
We value your perspective. Jamie Swift with Ballad Health, thanks so much.
Thank you.
Sarah?